If you want to succeed being a woman, you have to be your advocate first, that I can do this. And even if people are saying something, you have to give it a chance. The first step is empathy, and empathy comes from being a human. Down the line in future 5 years, 10 years, there will be, different sort of needs when AI will come in. So the needs will be different. It's not, I'd say, complete replacement. When you're an early stage startup, you should know what exact problem you're solving. There is a misconception, and there are some startups. How will you go to market? How will you tap into the market? Because you're there to earn money in the end, right? It's very difficult for men to talk to. They don't know where to go. They don't know who to ask the right information, and it's a taboo topic, right? Women can somehow go because, it's been emphasized. You can go to a gynecologist, a medical practitioner, you can ask questions, or you look for mentor. And you should look for mentors. You should look for people who you seek guidance from, you seek advice from.
Assalamu alaikum everyone, this is Hira presenting to you an exciting podcast by 2SS. Today we have got Dr. Maryam with us all the way from UK. She is shaking things up with the blend of healthcare and innovation. She is an health tech alchemist, she is an author, a mentor, a guide, and whatnot. Thank you so much, Maryam, for joining us today. Before we dive in, Maryam, you are igniting change at RNIB. RNIB is Royal National Institute of Blind People, for my audience. And you are also a speaker at FutureFest. FutureFest is not just a tech gig, it's a convergence point for change makers. It's where the rule breakers gather. And with Maryam in the house, let's dive into the health tech sector. Maryam, could you please tell us a little about your journey and yourself?
Thank you. First of all, thank you very, very much for inviting me to this podcast. And I'm very, very honored to be here. And obviously, I am a Pakistani first, and my transition, or you can say my, move to UK is very recent. So I'm very much attached to the ecosystem as well. And my journey also started from here. So I'm a University of Karachi graduate. I'm a PharmD graduate, a pharmacist by education or degree, and an innovator, you can say, by passion, which came later in my, journey. So I started off as a clinical pharmacist, or you can say trainee pharmacist at Al Khan University, Karachi. I practiced pharmacy for half a decade almost, and then I pivoted towards this innovation, you can say, sector or ecosystem when COVID happened. And actually, I didn't know that, there is a lot into the health tech sector where we can make change. And, being a pharmacist, I can do things which are different what I was doing earlier. So what happened actually was I was doing an innovation fellowship, which is one of its kind, and it was just, introduced during when COVID happened in January 2020. So I started my fellowship, and then COVID happened in March or later than that, and we went remote. All of us went remote, and the world changed. And during that time, I realized that how can we, make things better while being remote. And I guess that it wasn't just me, it was whole of the world who was, just realizing it, that we can do things better, even, being distance. But, it made us realize that there are other things that we can do while sitting at homes, or maybe when we were far and we can't do things in person, but we can do things virtually. And that is why I, when I completed my fellowship and COVID was over, but the fear was still there, and there were a lot of happenings, in the health tech sector. And I just decided to pursue that passion of innovation, and, I pivoted towards the startup sector. I worked with a couple of startups, and I worked with, a couple of projects which were related to e-pharmacy and how we can, pivot to that model from brick and mortar. Because during COVID, people were ordering medicines, and people were like, how can we access healthcare, remote? And people were reluctant also to, to access healthcare, that how can we talk to doctors? And they were not checking. They were just, talking to us remote and online. And how can this happen? And people were very, very reluctant. And now you can see it's a whole shift of thought. People say that everything can happen online. We can, talk to doctor. We can have consultations. So why go to hospital? It's very, it's very much changed. So that was something that I was passionate about, and I am very proud to make some to just contribute towards that cause during those times. And that taught me a lot. And while I pursued and worked with different startups here, there was one startup named as Doctors, And I did one of the project. I also worked with a pharmacy team. I was working with e-pharmacy there, and we were trying to inculcate this idea to connect community health workers with doctors and female doctors, actually, to provide them that access, because females who are sitting in villages, they don't have access to healthcare services, right? So they were working on that cause, that how can we leverage technology. And during COVID, it actually it actually proved to the world that it's beneficial, it's easier, and it's providing access, because earlier it was hard to convince people that it can actually happen. It's totally reliable, and you can actually talk to a doctor while sitting at home. Consultation can happen without going to hospital. So that was one of the cause. I worked with some of the super women there, because they're all very much female empower driven, and they empower females there. So I was lucky enough to work on a couple of projects there, and then during that, while I was working, I got to explore design thinking, and that is one of the innovation methodology, because I was working with different projects, and I was like, which methodologies can work while you're working with these projects. And design thinking was one of the things that was something that struck caught my eye, that this is something that is easier to pursue, and this is one of the methodology I can apply. So I did one of the innovation project with that startup, and that was using mobile health tech technology for women healthcare services, or how can you connect community health workers to doctors again while sitting in a very far area. And this project that I have done was in Thar, and Thar Parker is a desert, and you don't have WhatsApp there, or let's say you don't have the people there are not very much tech oriented or literate, and our target was to give access women there to healthcare services. And maybe we can train somehow their healthcare workers who are actually women. They're based there, and they are they're educated or literate enough to use technology. How can we use those health workers to connect the female patients, or let's say healthcare workers, through mobile or mobile technology. And then we also tested some sort of business models as well there, or you can say some services that we imagine that would help them to access healthcare. So that was one of very you can say community centered, or very much helpful in my learning, and I was honored enough to work on that project. And then the journey continued. I worked with one of the, I guess, mentor, and he's one of the guru in design thinking field, and Habibullah is his name. So he's also one of the speaker. I just knew. So he's also one of the mentors. So I worked with him with this another project that is VIA. It's a sexual healthcare wellness chatbot, which provides you information about your generic questions, and it is medically vetted questions. So the information in the chatbot is actually it's the true information, it's the right information. And when we were working on this project as well, we were just thinking how we can make it very much easy for audience to understand. We researched it, and that is another innovation project that I did. And I'm telling you about these innovation projects because these came along my journey. I explored, and I was like, how can I improve my role, or how can I do better? Not just being a pharmacist, or not just using my skills as a pharmacist, but what other skills I can add on, or what else I can do rather than just sitting on my technical skills. So I did some different certifications as well, and I came across different methodologies. I met different new people, and I was like, when they can do it, I can do it as well. So I learned it myself, and then I tried, and I got to work with these names and with these mentors. I learned a lot. So this was also one of the innovation project that I did. And during that journey as well, I realized that when you have that quest in yourself, I guess when you want to learn, there are multiple avenues, and nothing can stop you. So my journey, continued, and then I got an opportunity in Dubai. So I moved there with one of the largest integrated healthcare group in the research and innovation department. They were also working with different projects. So that continued. So this journey is, I'll say I'm still in that journey, because from UAE I moved to UK, which is very recent, I'd say. So 3 countries, 3 different regions, and I had different roles. Now I'm an innovation manager there. So I had very different, you can say, titles. I started as a pharmacist and then I transitioned and then I worked with different startups. I worked with consultancies. So it's a very diverse journey in terms of career, but in terms of personal journey as well, it taught me a lot. And I'd say I'm still learning. I still, learn different things every day. I still learn from my you can say my mentees and my students as well if I'm mentoring some program, and it's just the curiosity that keeps me going. It's like, yeah, it's the journey I still want to continue. So yeah, it's still a journey, I'd say.
That's so inspiring, Maryam. You are a big person today, but could you please take us to the that moment, unfiltered moments to Maryam's life when she was a student?
Of course. So I'd say when I started my degree, PharmD itself, and I graduated in 2015. So, it's, I don't know, it's not still a decade or so. So, yeah, when I started PharmD, I don't know, I guess it's a bit changed thought process when we graduate. Our parents, or, there's a societal pressure that you have to become a doctor or an engineer, and there's no other profession than that. And I guess in this era, it's a bit changed. People do understand there are different fields. But back then, when I just completed my 12th, and people were like, "You're good in academics," and my parents also desired, because you're a girl and you're good in sciences or biology, you should pursue being a doctor. And my interest was there as well. But at that age, because we don't have this career coaching sort of facility, or let's say privilege, where people know that what their interest is in these early stages, I was like, yeah, I can pursue medical, like every other girl says, like, okay, I have good academics, I can go for the medical field. So obviously I applied, and I was good in academics, and my name came in the self-finance list, and I was in the waiting list for merit. And I was like, this is a twist, because we were expecting that I can get the seat, and that didn't turn what we thought. And I was like, no, I'm not going to pursue it on self-finance, because I'm good in academics, so why not try other fields which is available. So I applied for PharmD, and my percentage was really good. I was in top 10, and my parents like, you can just wait, or maybe just wait for the another list, or maybe you can retire. And I was like, no, I'm very good in academics. I'm very confident that I can pursue PharmD. And when I was getting into PharmD, the interesting thing is, people were like, oh, it's a 5-year degree, and it's a lot of chemistry in there, and how would you study? It's very tough, and there is no scope. Honestly, when I entered in PharmD, everybody was like, it's just either hospital or it's just either industry, and you can't go into marketing because you're a girl. You can't do the field work because you're in Pakistan. It's very tough, and in hospital there's no life, which is to some extent true, because obviously you're serving your patients. It's a 24/7 sort of commitment. And I also worked in hospital, but people were like, there's no life, there's no growth, and why are you opting this? Just go for business administration, or let's say go for some other degree. I was so passionate about medical, because it truly was my interest, that I want to study something that is related to medicines. And we have a lot of fields, it's not just MBBS. So I was like, okay, let's get into it. And I started my PharmD, and that I'll say that Maryam was really different. She didn't know. She was just curious, as curious as I am today, when it was 7 years back, or maybe more than that. And I'd say I was curious at that time as well, that I was very much confident that I will carve my path out of it. I was confident that I will do something that is different, or that will be something that, not just practicing pharmacy, and I will explore all of my options. I never restricted myself, to be honest, personally. My parents were supportive, obviously, but myself as well, and I'm saying this down the line, 7 years, I realized you have to be confident in yourself. You have to be very much, your own fan. If you want to succeed being a woman, you have to be your advocate first, that I can do this. And even if people are saying something, you have to give it a chance. Either people are saying that it's not for girls, it's a field work, it's marketing, you can't. If I remember, I can say that there are hundreds of interviews that I failed, or you can say I just, I didn't get through, but I learned from those experiences. And when I learned that, I'm here because of that, because you learn something, you never fail. So I guess that Maryam and this Maryam is like, I'd say it's same in terms of curiosity, but yeah, that exploration part, yeah, changed me a lot, yeah, during the journey.
Yeah, there must be a lot of challenges. Could you share some challenges while transitioning from Pakistan to UK, and how did you overcome them?
So yeah, there were many challenges, and I'd say that whenever you talk about challenges, it's mainly when you come from a low middle income or middle income country, it's about finances first, then it's about being a girl, which is, which is very much comes with your security reasons, or let's say concern of your family. Then you can say there are emotional challenges as well, because it seems that moving is, easy, and you're going to a very, you can say, glittery world, or let's say glamorous sort of move, that it's a very established country and you're moving to a good place. But those were also my challenges. But in terms of, I'd say, family challenges, it was fine with me. My family was supportive enough to, give me that freedom or strength, independence, that I can do it. But emotionally, I was very much, I was scared, because I'm a woman, to move to a new country. And it was my first time to move on my own. I never traveled before, when I moved to Dubai. So I was very much scared that how I'm gonna, cope, and I'm gonna, work there as well on my own, live on my own. So emotionally, I was very scared. Then I'd say there was a challenge of convincing, your loved ones as well, and then the society, because we are in 21st century. People still perceive it's very tough to live on your own being a woman, and it still is a challenge, a huge challenge. People perceive of you very differently when you live on your own, when you're independent, when you move country on your own. And it's not just me. I've heard the same from my circle, from my friends as well, that it still is, even when you're financially independent, or let's say you're established enough and you're on your own, you're stable, but still people like, oh, she lives alone, she's in another country, how is she, So that still is a challenge. But I'd say apart from that, yeah, the most of the part is actually the society thing, convincing parents, and it takes time, and it took me almost, more than a year to make them understand that I'm fine, I'm doing fine, it's fine to live on your own, it's very safe to live on your own if you are in UAE, and it's a Muslim country, and even if you're a woman, you can, you can have your own life, so it's easy. But it still is I'd say a challenge to make sure that they're convinced they're fine with this perception that I'm on my own. Though I'm not right now. I'm married, and now I'm in UK, which is another different country. But yeah, I guess the bigger challenges comes from society. It's the pressure that comes. Yeah.
And Alhamdulillah, you are doing fine now. Maryam left Pakistan and she settled in the UK. Do you find yourself missing Pakistan, and what do you miss the most?
Of course, so why not? Who doesn't, miss the country? And I honestly miss the food. I'm a big foodie. I'm from Karachi, so I miss the spicy food from Karachi a lot, and I miss the weather. I really miss the weather. We do have all four weathers: the rain, the summer, the winter. So I really miss, that. And what else? Yeah, I guess my people, my family, of course. But yeah, it's majorly the food and weather.
Okay. Coming back to healthcare sector, is there any specific thing that you would like to bring from Pakistan to the UK?
Yes, there are actually many learnings, and we are very good at doing, I'd say, jugaad innovation, and this is one of the term I'm using from the book that I co-authored with my other colleagues when I was working at Aakan University, and we authored this book, which I'll come later on. I'll discuss it later. So this jugaad innovation, or you can say frugal innovation, or term, is about, reversing the innovation, or let's say applying the learnings from your experience to innovate, or let's say to improve the existing services or products, because it's not just always true that innovation happens when you have high tech or you have many resources. Innovation can happen when you have very limited resources. Let's say being Pakistan, being a middle income country, having different challenges than a high income country, we have very limited resources, but we do innovate, and we do it very well. We don't know it, but we do it, and it's not just in health tech sector, it's in other sectors as well. We do find out a way to do things that is different than other methodologies or proven methodologies, or let's say the methods which are written in book. We don't go by book. Sometimes we find a different way to do it when we want to do it fast, or we do have very limited resources, so it's different. So I guess that's the one thing that I'm still, I try to apply myself as well when I'm working in the UK, though I'm very new to that ecosystem. But that's very much appreciated because, when you use less resources than available resources, and people are like, wow, you can do it, this way as well. It's very much simple, and we didn't think it that way because we had that privilege of having those resources or using that resources, but because me being lucky enough to working from this environment, I knew things, and I knew those tricks that okay, we can work it this way or that way, or we can communicate to people, make things easier, or we can focus on other things to make things better, and innovation is easier as that. And yeah, that's really one thing that I want to take from this ecosystem, from my learnings from Pakistan. And then there are other things as well from Pakistan. The resilience, I'd say, the resilience in our people, and the quality that I see, that we persist, we keep doing things, and we are very persistent. That's one thing, because in that ecosystem, or I'd say in that ecosystem, people are like, okay, if this is not working, let's switch to maybe other methodology, or maybe some other techniques, or some other ways of doing things. But because we don't have that privilege, or let's say we don't have that mindset, we are very persistent to keep that thing going, or being very persistent. So that's one thing that I learned here, and I'd say I'm applying that there as well. So these are the two major things that I'd say, yeah, we can take it from our ecosystem.
Maryam, I'm curious, what was the eureka or aha moment when you realized you should transition from healthcare to health tech sector, and you realized the potential of health tech in patient care?
Aha moment. Okay. I guess there are many moments. There wasn't just one moment. But yeah, so I was practicing pharmacy, as I mentioned. I was, earlier working in hospital sector, then I switched to community sector. And I was constantly looking for something that is, challenging enough, because 4 years down the line, I was working and practicing pharmacy, and I was doing the same thing. I felt that I'm doing the same thing every day. It's 9 to 5. Let's say, for example, I'm dispensing medicines, or I'm talking to people, the same thing, the same counseling, the same hospital, the same environment, or let's say the same community pharmacy. I wanted to do things different. I wanted to learn. So and innovation was a buzzword 4 years ago. It was very new. Now it's a bit receptive to people. But that time, I was looking for something to, that challenges me, and I wanted to study. So I was looking for something that is different. I was looking for degrees, and I came across this innovation fellowship, which was announced by the same hospital where I worked at, Ahman University. And I was like, let's try this. And interestingly, before this fellowship, I was connected to different communities, or you can say different platforms, because I was always curious that, what is a startup? What does they do? And, there are different new names, and there were different communities emerging at that time. And I was part of those networks, and I was always very much, interested to know more, that what do they do actually, because we have got the same degrees, but I'm doing a different, work, and they're doing different. So what is so different about them? What is that I can't do, or what is that I need to learn? So I'd say that that moment that I realized that I need to study more, let's say I need to know more, I need to go beyond what I was doing already. That moment was actually that I hold it on, and I explored that, okay, what are the options? And this innovation fellowship came across. I got into it, and when I pursued it, it was a 1-year fellowship actually, and it was a mix of, where you learn things as well, and where you train yourself as well while being at the setup. So that 1 year, actually, I'd say that it was a aha moment. It made me, very confident that now is the time I can pivot, or now is the time I can do things better, or now is the time I want to change or I want to do better, no matter if it takes a leap of faith. And it took a leap of, I'd say, faith. And I didn't find a relevant thing, for a couple of months in between doing projects, or, the thing that I wanted to pursue, or I wanted to work for or work with those people, or, those kind of projects. And I was like, what am I going to do if I don't find it? Will I have to go back to the same practice, which I didn't want to? And people were like, it's fine, you can go back, you can, just pursue, because there are no opportunities. Nobody understands what innovation is, and it's just a fancy word. And if you want to do it, you just have to go to, just multinationals or big companies, and you have to get experience maybe from abroad or something like that, because people don't understand innovation. What can you do differently? It's just same. And I'd say innovation is not tangible, of course. It sometimes is tangible when you're doing some products, or let's say there are no metrics, but it's a mindset, and mindset takes time. And we do know we are innovating. Some people don't realize they're actually innovating, and they're like, we're just doing this same work. So what's so different that you're doing? And they are, they just don't realize that it's the innovation actually, what you're actually doing. You're just not saying the word. So that moment was really the game changer for me. And I was like, I will continue to do so, and I will continue this path. I will continue exploring options. If not, I will maybe go back for time being. That was in back of my mind, but all of my efforts was to find something maybe on a very, very small scale. But if it's relevant and if it's something that I want to do, I will pursue it. And yeah, I did actually.
Maryam, I have another thought. In this tech-packed world where there's tech everywhere,
Yeah.
do you think there's still a room for human touch in treatments, or are we all just becoming tech zombies?
Absolutely. And you can't change it. And this is for a fact when we say human-centered design, and design thinking is a methodology in itself, but we say that whenever we design a product or a service, it should be human-centered. And this is something that I learned from both of my mentors and from the people that I worked with, that whenever you design a service or a product, you should keep humans in mind, because at the end of the day, you're a human. So that human-centered product or service should be very much, relevant to that human. No matter what, if it's an app or let's say how much tech is involved, there will always be a human side of that service or product, or human touch, because it's very important. And, the first step of design thinking, when we apply this methodology, and when we, when we do projects and we say that we follow design thinking, the first step is empathy. And empathy comes from living being a human. So you can't eliminate that, right? So there always will be a need, and there's a debate, I'd say, but you can't eliminate a human touch. It will always be there, but it might, there might be technology-oriented things, and there are services and products right now as well that is, augmenting that that human. Maybe, for example, a doctor, we have got tools and we have got different apps, but it's just augmenting that human or that doctor to have more time with this patient, which is, again, what are we doing? We're increasing that time, human to human, time, and that is improving that patient care, right? Because patients need time. Honestly, I worked in practice and in clinical practice. When you're talking with patients, half of the time is just, that conversation that makes patient feel better, or they feel that my doctor is listening to me, or they're attentive to me. It's not just the prescription they're writing, it's not just the medicines that they're giving, it's that talk, or it's, let's say, it's that listening power. And where it is coming from, it's empathy. It's when you know that how painful it is to be a patient, and the doctor is like, how important it is for a patient, to listen to the disease or whatsoever condition he's going through, only that listening makes him feel better, right? So you can't eliminate. And it's my personal thought that it will always be there, because ultimately you're designing for humans, and you only survive when you think, human centered, and you're designing those products or service, keeping that ultimately it's the interaction for humans. Humans are going to use it, right? Robots are not going to use robots. So it's true. Who are you designing it for? For humans, right? So humans are there. So you have to keep in mind that ultimately it's for humans. So that's very, very important, I'd say.
True. And in Pakistan, in fact, globally, Mariam, sight loss is hitting kids hard. Women are more severe to sight loss due to hormonal changes and whatnot. And if I highlight the UK story, I have heard some great success stories. Can you highlight any success story where they have made a great difference in the life of someone who has who are facing sight loss?
Of course, I'd say sight loss is it's a topic. It's one of the, I'd say, differently. It's similar to differently abled people. So sight loss is one of that sense that you lose, and it's not just for, let's say, if you're born with with blindness, you go through this journey maybe later in time or later in life as well. And when we're talking about women, there are different conditions and there are different causes that women go through, and that is why they go blind, or let's say they lose their sight or they go partially blind. And then when they enter into that journey, it's very difficult for them to cope up. In terms of success stories, there are many projects that UK is working on overall, or I'll say my organization is working on or worked on. And it's not just for blind people. It's overall the accessibility part that we cover, or let's say when we talk about these sort of projects or services, or let's say product design for these people, it is in our mind that it should be accessible for everyone, number one, and number two, it should be more accessible to the people who are facing blindness or who are going through this journey. So one of the success story that is very recent is about QR code. I'd say it's not a QR code. It's actually a very advanced form of QR code that is named as Navilens. And this is a very recent project. What we did is we put that code on the packaging. We talked to the company, obviously, to make their packaging, accessible. What if people can't see? Because blind people can't see what products are there in the supermarket, right? Either it should be braille printed because they feel and they read what the product is, but in that case, they have to feel and touch every product, right? So we wanted them to use their phones when they direct their phone, or let's say it's as simpler as we scan our QR code, a QR code on a packaging with our phone, and we know that what the product is. But that is what we see. What about the people who can't see, or, who are far sighted, or let's say who are partially sighted? So this code on the packaging, specifically on the cornflakes packaging, because this is still in trial period, this has been printed on the packaging. And what it does is when you enter the store, and let's say there's a cornflake packet on the shelf with that Navilens code, you direct your phone 2.5 feet away at least. It will just pick that code and it will read what the product is with all of the information, let's say all of the nutritional facts as well, the flavor and everything that has been mentioned on the packaging. And that went really well. It's still in a pilot phase, as I mentioned. It's still in trial phase, but that made things easier even for sighted people. You just enter in the store, you point your phone towards that packaging, and it says that, okay, this is this brand of cornflakes, this is this flavor, and it reads out. So you don't have to go pick every box, read it up. So you see, it's not just making accessible it for just blind people. It's also accessible for maybe say older age people, or let's say people like us as well. We have to navigate through all the shelves. What if it's on each and every packaging? You just point your phone, oh, this is on this shelf, I don't want to go on this shelf, or I don't want this product. So this is one of the success story, and I guess this is very much easier for the brands that come in here as well. Obviously there is another debate on operations, or let's say change of packaging in itself, but making things accessible is something that is a success story in itself. That when you think about making things accessible, it's accessible for everyone. It's not just for one population, one community. It's easier for everyone. And I didn't know, unless when I entered in this organization, I didn't know that how you make documents accessible. Because what if people can't see? It's just one sense, right? Sight is one of your five senses. What if they just can hear, or what if they just can, maybe read braille? So what about those people? If they can't see, we make slides prettier, we make our documents prettier, but what about people who can't see? So there must be something out for them as well. And I didn't think of it earlier because I never worked with those people, and now I'm working with those people, and now I know their challenges, and it's very, very much eye-opening for myself that we are not making things easier. It's just that we think about ourselves, or people like us. What about people with different abilities, not just blindness? What if they hear, their hearing difficulties? What if they're older ages people? And this is very much, this should be in our thoughts, being humans, that we should make things easier rather than just making things difficult. So this is just one of the success story. But yeah, all in all, it's about accessibility, I'd say. It's not just for working for blind people or making things easier for blind people. So yes.
How about we peek into the future, Maryam? What mind-blowing tech can we expect in the next 5 or 10 years?
Of course, AI, and it's not just me who is just, very much curious, or let's say exploring the options with AI. And we all know about ChatGPT, how it's making things easier, or maybe how it's manipulating for some people. But I guess the right use of technology will improve our capability as humans, the right use of AI. And there will be, a huge role, and there will be roles which will be replaced. But I'll say that if you're a smart human, you will know how to use that technology, to leverage that technology to make things better and to make your job easier and to, I'd say, perform better. So AI is something I'm very, very much, curious about. And I myself, also, explore these sort of apps whenever it comes through. And we are also hearing about, AI-driven robots as well, automated happenings as well. So there's a lot. And honestly, AI is something that will totally change the landscape and the needs and the opportunities. So things that we are not thinking right now, maybe down the line in future 5 years, 10 years, there will be, different sort of needs when AI will come in. So the needs will be different. It's not, I'd say, complete replacement, but there will be, need of human to verify maybe some information that is being provided by AI. There will be diagnosis, but it will be on human, to finalize, okay, these are the 3 diagnoses coming from, AI. Just, when checking a patient, let's say their symptoms, and there are like 3 options which AI can give you, that this is the diagnosis, and there's this AI doctor, and the human will be there to confirm either this is the case, because in many cases, it comes from practice. So a human would be there, but again, the needs would be, different. So I'm very much myself, curious about how AI will turn things, down the line in 5-10 years.
Absolutely. AI is on the horizon, right? Can AI be the hero in treating chronic illness?
I'd say I won't use the word hero. It could be a devil, who knows, in future. But yeah, I'd say it will be a game changer in terms of treatment. And, in chronic illnesses, or let's say in chronic management, there is a huge room, and we're still managing those diseases because chronic diseases are lifelong diseases. But it will serve as a hero, maybe half hero, you can say, or it will just, again, augment how we are managing things right now in chronic diseases. And it will help us to maybe manage better. But I'm not sure how it will just eliminate the illness itself, because chronic illnesses or chronic diseases are lifelong. You can't change that fact, It is just, preventing more damage, you can say, and managing whatsoever condition you're going through. So maybe we'll have more better ways to manage that, maybe more better way of monitoring, maybe more better ways of managing, or maybe some different lifestyle, changes that we don't know right now. But maybe in the future, with the help of AI, we'll be able to do better or manage better. But I'm not sure about being 100% hero. AI is a very, very tricky technology, and it's very new to us right now. Maybe down the line, we'll be refining it more. Let's see.
True. Maryam, she's not just into healthcare. She is also a mentor. She has been mentoring startups in Nigeria and Bangladesh, and I got to know how amazing mentor you are. Maryam, you have been guiding startups. What are the key elements that the early stage entrepreneurs they should focus on?
There are many elements, to be honest, and while you're working into different ecosystems, the startups needs are different when you're in early stage. But I'd say there are two things that I observed, and it's not just from my experience from Nigeria and Bangladesh, because I was part of Unleash Accelerator program and their global innovation lab, and there are different startups there. I got to mentor these two teams from these two countries specifically, and this year I have got one more team from Mongolia. So when I talk to startups, these two things that I actually observe from all of the ecosystems, from all of my experience, is, one of the first thing is the problem that you're solving. When you're an early stage startup, you should know what exact problem you're solving. There is a misconception, and there are some startups that I observe when they come to me or when I mentor them. It's the solution that they're focusing on. It's like, we can make an app, we can make a website, we can make a chatbot. So they start off with solution, while my observation is, and it's a learning as well. I guess many of the startup knows this. Whenever you start off in design thinking as well, you go from problem to solution. So you should know what the problem is that you're solving, and you should be clear enough with that problem statement. Now, sometimes it's a very huge area that startups want to focus on, but if you're not defining the problem that you're going to solve, you're not going to succeed in long term, because you can't solve every problem in one go, right? So you have to be very much laser focused on what one problem you're solving. Let's say we all know, there is a huge healthcare gap. Let's say there are many problems in healthcare ecosystem, right? We want to make access easier. We want to improve lives. We want to provide so and so service. But what exactly you're solving, and what is the pain point? So I'd say for an early stage startup, and if you're thinking to be an entrepreneur or start a startup, you should think of that problem very clearly, and you should think of that pain point. Being a human, let's say, if I want to start a startup, let's say in healthcare, what is my pain point? What is that pain that I go through in my journey, or let's say in accessing healthcare, if I'm solving some problem in healthcare? So when you point out that pain point and you pick that is something that goes a long way. That is that starting point that you're very clear about. That is the point that that, okay, this is the problem I'm going to solve, and this is and that is why those startups who knows the pain point, who are solving the right problem, they get through the solution. And sometimes when you propose a solution, it might change. When you reiterate, it goes into the customer base, or let's say users, and they want the solution in a different way, but the pain point remains same. So when you know the pain point, the solution will automatically comes in. So that is one thing when you are an early stage startup. The second thing is go to market strategy. And I'm saying this because people are more focused towards funding. When you're new, when you're an early stage startup, all of the focus is towards pre-seed fund or seed fund, that we need money to run things, or let's say to test our idea. That is right to some extent, but you should have that strategy as well. What will you do with that money? How will you go to market, and how will you plan those finances? What happens is, which I observe very frequently in my experiences, the journey when you're getting that money, and once you get that money, you don't know what to do that money. So you go through that cash burnout. And this is also one of the reasons why startups shut down and they close. So obviously not in every case, but this is my experience, what I observed, that when you are an early stage startup, you should be very clear what problem you're solving, what pain point is that you want to focus. And the second thing is your go-to-market strategy. How will you go to market? How will you tap into the market? Because you're there to earn money in the end, right? You have to make some revenue, either if it's not in form of money, what is that you want back? So you have to have that strategy in line very clearly, that what will be the metrics that you're going to cover? How will you capture market? What is that open market segment? Because if you don't know your users, there's no point of starting a startup. You're saying that I'm solving this problem, or I'm, improving healthcare. For whom and why? Do you know that people want it? If they don't want it, there's no use, no matter how high-tech app is or how high-tech device you're inventing, or maybe the solution. If there is no pain, you're not solving a problem. So these are the 2 points in my experience that startups should, think about when they're or they're in their early stages, or they're thinking even, to start it before starting. Yeah. So yeah.
Yeah. And you also launched a product via, you played a key role in launching it. And to my understanding, it's a chatbot for reproductive health and for the family planning. Could you please take us to the initial spark of the idea?
So I'd say the spark is actually PSI itself, who is the owner of this product, or I'd say who launched this product in itself. I worked as a consultant and on this project for curating the content in itself, because we realized that there is a huge need with PSI. Obviously, we explored, this problem space of family planning, and it's been going on for decades now, that how can we improve awareness on sexual health and well-being. So there must be some solution or an outlet where people can come and ask questions. Now there are some outlets where people go and ask, but it's not very frequent, because number one, family planning and sexual health and well-being is a taboo topic, right? Then secondly, people don't know where to access the right information, the right medical information, or let's say information which they can understand in easy language. These two were the problems, and I guess that is exactly the spark, that how can we make this better. And then the third and very important thing is, how can we aware men in our society, because when it comes to family planning or sexual health and well-being, people are like, oh, it's about women and children, so it's about maternal health, and people take this aspect or perspective because it's easier to make them understand, while you take this aspect that, oh, it's about mother and child's health, oh, it's about women, and women can only talk to women. So people are like, oh, you can go to gynecologist, or you can talk to a lady health doctor or lady health worker, and it's just women problem, which is not the case. And we were like, it's very important to work on men's awareness as well, and it's equally important for both of the genders, and it's equally important for youth as well, because there are myths. There is Google, obviously. When you have questions and you're going through your teenagers, and then you go through that cycle of your whole life, the journey of exploring sexual health and well-being from very early age. Where do they go? Who do they ask? Because it's taboo. Some families, or in some cases, people do know the information, the right information, because of the environment, but in most of the cases, there are no outlets to. And it's very much difficult for men when we research and when we talk to subject matter experts and people, that what are their experiences, who do they ask during their journey from puberty to, let's say, being unmarried and then married. So what is their journey? And it came out that it's very difficult for men to talk to. They don't know where to go. They don't know who to ask the right information. And it's a taboo topic, right? Women can somehow go, because it's been emphasized, you can go to a gynecologist, a medical practitioner, you can ask questions. But who do men go to? And why they don't know the right information? What's the outlet? And that is why PSI wanted to, we actually worked. They wanted us to work as well. And then being design thinkers, we also, wanted to work with them to how to launch that very product, or that outlet where people can go access that information, the right information, and where they don't have that fear of, taboo talking to a human, that, if there's a helpline, they don't call because, oh, there's a shame in calling, there's a shame in, asking. So there should be a chatbot, and there should be right information right there where they can just put in the question and, have that information. And the very important part, which I, worked upon, and I really worked hard on it, to convert that information in a language that people can understand, because the information is out there. Each and everything is out there if you search, but people don't understand. Obviously, it's medical terminologies. There are helplines, but people don't call. There are people they can talk to, but they don't know that they exist, those people, those organizations, and the information is very scattered. It's dispersed amongst, different outlets. So I just, curated that information in a way that it's understandable, it's easy. And then we added, the questions in that chatbot in a form that, people actually ask. Those are not just FAQs or frequently, normally asked questions that are there on websites. They're truly the questions that came from our research when we talk to people, that, this is the questions. We know the generic information. For example, we know what products are out there for family planning, but we don't know how to use it, right? tablets out there. Everybody knows it. We go to a medical store, we ask him, he gave us the tablet, but we don't know how to use it, right? Or we don't know the names, or we don't know when it works, when it doesn't work, when to take it. So this is very important. And that was the target of this chatbot, Whole in All, that we provide information in a way that is easier to access. We provide information to the right user segment. We provide the relevant information to the relevant age group. Let's say if you're a teenager and you want to know some questions and you're curious about for example, puberty questions. So they should have access to only that information, not the other information, which is everything is out there on Google, right? So we curated it in a way that the right segment can access the right information. So that was actually the main, starting point, or you can say spark, while working with PSI. And I'm very, very grateful to Aisha Lagari. And I'm mentioning her name because she is also one of the, I'd say, very much, not the direct mentor, but she's a very, very inspiring leader and women in this sector. And I'm very much honored to have worked with her, and she have, given this chance. So I just wanted to mention her name. And I'm truly, truly proud of this project. I have learned a lot myself. Even I'm a healthcare professional, but when I explored and when I talked to people, I was, very much astonished. And it was mind-boggling for me that people don't know the basics and they don't discuss it. There is still a shame. We're in 21st century. We do have access to all of the social media platforms and whatnot, but we don't know the basics as a society. And it still is taboo to talk about this topic. And why is this? You have got information for every other topic. Why not we talk about this? And it's very important to talk about this because this is a huge issue in our country, so you should know the right information rather than going towards, the wrong information, and then the perception or, the consequences when you don't know the right thing to do. So, yeah.
Absolutely, Maryam. And even today, in many cultures, it is considered a very sensitive one. And you are also a co-author at MedCheck. So could you please tell us a little about that book, and also what's so special or noteworthy for the book?
Okay, so the book in itself is very, very special. It's called MedCheck, and an extraordinary journey for ordinary, from an ordinary experience. And it's the book in itself is about the journey, how we started being an innovation platform, and it's about how we kept it going and how we transformed into now running a fellowship in itself. And I'd like to mention CCIT and Dr. Asad Mia, who is one of the, you can say co-founder or co-director, for this platform. And when CCIT started, and CCIT actually stands for Critical Creative Innovative Thinking Platform. When it started, it was a group of medical students. Dr. Asad Mia started it at Khan University as a community platform, or you can say as a students platform where students can come and discuss some sort of new medical ideas, what they want to work at, apart from the, usual syllabus and usual their routine. And that was a student platform. And at that time, I was working at AKU as trainee as well. So I went to some of the, you can say some of the sittings, where students can sit, discuss their ideas. And then there were these Ignite sessions which I attended very, very early on. And we weren't a sort of space that we are now in AKU. And I'm mentioning we because I'm part of that book and I'm still part of the alumni. So, and that was actually the point where I pivoted towards the innovation ecosystem. And I'm very thankful to Dr. Asad Mia. He's also one of my mentor. So at that time, we started off as a student platform, and then we grew over. We had some student ideas, and they wanted to, pursue the startup mindset. They were the students who wanted to do something apart from the usual medical journey, and they wanted to, work. And we were like, why not give them a chance? Why not, work with them? Why not explore? And it was sort of in-house, you can say, startups that started, or ideas that actually started. And now there are actually startups. There are some startups that are, now out of AKU, and they're growing very, successfully, and they worked on those ideas. So this book is very close to my heart because it covers the whole journey. I wasn't part of the whole journey when it started, and it's still going on. I came in between somewhere, but I saw, because I myself was a trainee when this was very, very, early stage platform, and then the innovation fellowship started. So I had the honor of being part of that community. Then I did my fellowship as an innovation fellow, and after completing that fellowship, I also worked for a very short time as a consultant as well for CCIT. So it's, and then an author as well. So we co-authored, and we are like 14 authors for the book, including Dr. Asad Mia. We are different people from, including fellows as well, people who are part of that journey. And I'd say the authors, all of the authors, we are from different parts of the world right now. They're all, in different countries. And it was a huge success because it mentions the journey in itself, how the innovation journey was in health tech, and how we started inside the big hospital, how we changed some perceptions, how we were able to inculcate and just initiate that innovation mindset, that what critical thinking is, what creativity and innovation is. And Dr. Asad Mia is, obviously it's his credit. It was his brainchild to start off this sort of platform, and then we grew, and then the team worked for this innovation fellowship, that we need to train people into innovation sector and how they can inculcate this very methodology in the medical field. So this is a journey. It includes all of the, I can say, steps we went through when we were innovating, and now where we at. There are different chapters, including how we were able to carve our own methodologies as well to spread this mindset and to spread innovation, and let's say just making people understand what actually we do when we mention that, okay, we're innovating and we're a creative platform, because it sounds like very buzzword, and they say what different you're doing. So this was very hard when we started, and now it has been grown to, I guess there is 4th or 5th batch of innovation fellowship that CCIT is running. And then we launched this very book, MedJack, as well. And it was the first, I guess, digital book that we launched in AKU. And I am very honored to be part of it. And it was, now it feels like a dream come true, being a co-author and, authoring that, writing that journey that we didn't know at that time that we will be, authoring this in written form and, making people understand. And people are like, oh, this is something that we can do. That very book is, it's a game changer book, that there is something called innovation. There's something that we can do while being in a setup, because we were able to do it while in a big hospital, while doing our daily day jobs, and then pursuing innovation, and then doing something differently, or at least trying. All of us who are part of this journey, they're very brilliant people. I learned from all of them, and they're all very, very, innovative sort of people. And they were like, we'll do it no matter what. We'll figure out a way. So these were the people, and they are truly innovators. And it's mentioned there. I'll just, like to suggest that you should go check out the book, check out the reviews as well. It's very much interesting if you are into medical sector, health sector. You want to know what the basic ideas are, and how you can actually pursue innovation if you want to, and how you can actually make small changes, rather than just thinking innovation is just something that is high tech, or something that needs huge resources, and you can't do innovation while being into your role. If you're working, if you're a student, it's for everyone. So if you are into health sector, if you're interested about innovation, especially in this ecosystem and how we were able to do it, you should definitely check out the book.
I'll definitely check it out. Finally, it's time to give our health tech community a wake-up call. Maryam, what's your call to action for supporting health-focused causes?
I'd say it all starts with awareness, and it all starts with giving back. So, at the least, because, you have that information, and it's your duty to pass it on to your next, you can say, generation of people who are working or into similar field. You have to talk to them. So for the community, I'd say just be there to support and it's not the financial support that I'm talking about. You can at least give them, that awareness, that mentorship, because there is a huge lack. And I try my best to, mentor people or even talk to people. There are many students, there are many, many communities, there are conferences happening, there are workshops happening. There's a lot that's happening, and that's a good thing that the community is doing. But I guess there's a lack of this mentorship still. If I talk about just pharmacy, I'd say there still is a gap. We don't have career coaching in itself. So for the community, I'll say just guide people what your journey is and how you were able to do it. If you can do it, they can do it as well. And what are your learnings? And for younger generation, it's like you don't reach out to your seniors, especially asking for, just job opportunities, because that's what I observed from my personal, experiences. Whenever a junior reaches out to you, it's like, oh, you work there. Can you, just give me a gist, or if there's something that if there's a chance I can apply or something like that. If you are reaching out to your senior, ask for a good, mentor, ask for the guidance, ask for advice. Because when you're starting your career, you need that mentor. You need that, coach who can guide you to the right path. If you find that person, you will be successful. If not right now, maybe later in the future. I found my mentors later in my journey. When I realized that, okay, these are my mentors, or these are the people who I want to, follow, or if not follow, these are the people I want to be like, or these are the people who inspires me. These are the people who I admire. These are the people who are working beyond their skill set, or, they're working on multiple dimensions. Now, Dr. Sadmia, for example, he's an ER, physician, and he's working full time, as an ER pediatrician physician. So he's a doctor, right? So, but he's practicing that. But apart from that, he's not stopped just by doing that. I'm a doctor. I'm an experienced doctor. He's doing a lot of different things as well. So he was also, he was one of the people who inspires me a lot. That okay, he's doing different things. If he's doing it, what can I do myself to to be the same person, or at least to follow the path what he followed, and what are the challenges. I'm a person who seeks challenges, something that is, different, that I want to try, or difficult. So I guess it's very important for the community to be there for their younger people. And for younger people, it's important when you reach out to someone or you look for mentor. And you should look for mentors. You should look for people who you seek guidance from, you seek advice from, that what do you want to do. So down the line, it will be easier for them to, carve path. And same goes for the community. You should be there for awareness. You shouldn't just be there for some of the workshops maybe, or some of the conferences. If someone reaches out to you, you should support them in either way you can. If you can, finance something, or anyway, do it. If you can talk to them, just talk to them. If you can answer some of the questions, just do it. Because this is a cycle that should go on for community. And then it's very important to support the causes. Let's say some of the conferences like Future Fest that you guys are just organizing, or some of the events or networking chances. It's important to support those sort of causes, because that's the avenue where people meet, and where people have have the chance to look for opportunities. So it's very important for the communities to support these sort of networking collaborations and opportunities, where people can automatically meet, and eventually you can meet maybe your mentors, or you can have a good advice that goes lifelong. And this is actually very beneficial in my personal journey as well. I used to be a person or a student who goes to every maybe conference. If there's something happening, I used to check it out. Rather it's directly relevant to pharmacy or not, it was just medical, I used to just enroll and see that if there's something I can learn, or if there are people that I admire, or there are people who I want to know more about, and they're experts in their field. So you learn. So it's very important to have these sort of opportunities and chances to network.
Maryam, since you are an author, you are a design thinker, a mentor, a guide, and a alchemist, what is the theme or the topic you would like to present at the Future Fest?
That's a very, very, it's a difficult topic. There are many, many things that I'd like to talk about. But what I want to talk about is specifically women in health tech, because we do have many technologies to talk about. We do have many products and services to talk about. But I'd like to talk, majorly about what women are doing, how many actually women are, making waves in the health tech, or how they're innovating, and how women innovators are actually, contributing to the sector. And not just in Pakistan, I'm talking global. And I still see this gap. When I was a student, it was very hard for me to, find a mentor, or let's say a women role model who is a pharmacist as well and doing things differently. It was hard for me because obviously in our society it's difficult to find such a women. And when I traveled, and now that I have, exposure of 3 different regions or countries, I'd say it still is difficult. It's an ongoing journey, and it's a very, very, I guess, say, long path to seek for women entrepreneurs, or let's say women innovators or women leaders. So this is one thing that I would very much like to talk about, role of women innovators in health tech, or women leaders, I'd say.
Big thanks to Dr. Maryam for sharing our thinkings today. And for my audience, let's take these learnings and challenge ourselves to think differently. I am Hiranu from FutureFest signing off. Jazakallah.
Thank you so much.